Today, we're going to discuss therapeutic ultrasound as a physical agent. We'll cover the physics behind it, how it works clinically, and how to apply it safely and effectively in practice. Ultrasound is a type of sound wave, specifically a compression and rarefaction wave. What makes it unique is its frequency. Anything above 20,000 hertz is considered ultrasound, which means it's not audible to the human ear. Clinically, we use these high frequency waves to interact with tissues in a therapeutic way. Ultrasound is generated through something called the reverse piezoelectric effect. When alternating electrical current is applied to a crystal in the transducer, it causes the crystal to expand and contract rapidly. This vibration produces sound waves that can penetrate the body, effectively converting electrical energy into mechanical energy. When we say that sound is a compression rarefaction wave, we're describing how energy moves through a medium like tissue. As the ultrasound wave moves through tissue, it creates alternating regions of compression where particles are pushed closer together, increasing pressure and density, and rarefaction where particles are pulled farther apart, decreasing pressure and density. Importantly, the particles themselves don't travel across the tissue. They oscillate around their resting position. What actually moves is the energy. In therapeutic ultrasound, these repeated cycles of compression and rarefaction create mechanical effects at the cellular level, which can lead to both thermal effects, like tissue heating, and non-thermal effects, such as fluid movement and cellular stimulation. So when you're using ultrasound clinically, you're really delivering a series of rapid pressure changes into the tissue that can influence how that tissue behaves and heals. This is a visualization of a longitudinal compression rarefaction wave in slow motion. A compression zone is quickly identified because when the particles are compressed and form a dark area, the rarefaction zones are recognized as the lightest zones due to the low density of particles. A potentially helpful way to think about this is like a speaker. A speaker converts electrical energy into mechanical motion, which then creates sound waves by compressing the air. Ultrasound works similarly, except instead of producing audible sound, it produces high frequency waves used therapeutically. This is a video of what happens to the ultrasound gel when you turn the ultrasound unit on. You can see the vibration of the gel as the sound waves pass through it, much like the previous video of the speaker. Just for your information, there is a principle called the direct piezoelectric effect. The direct piezoelectric effect is when energy is produced by a crystal being mechanically stressed. This principle is important because it explains both how ultrasound is generated and how tissues, like bone, can respond to mechanical forces. Ultrasound has two primary purposes: thermal and non-thermal. Thermal effects involve tissue heating, while non-thermal effects are more related to tissue healing and processes like phonophoresis, which will be discussed later. When using ultrasound, you need to consider several key parameters and how each impacts treatment. These parameters include intensity, frequency, duty cycle, time, and patient position. Like learning any new language, it is important to understand what each of these values means and the units of measurement for each. Intensity is measured in watts per centimeter squared and represents the amount of energy delivered to the tissue. It's important to note that this is not the same as power, which is measured in watts, which is used for calibration of the machine. Make sure that when you are using the ultrasound machines, that they are in the watts per centimeter squared mode. The beam non-uniformity ratio, or BNR, describes how evenly the ultrasound energy is distributed from the sound head. It's the ratio of the maximum intensity to the average intensity. The FDA requires that BNR be less than 6:1 to ensure safety. The reason why it is important to know this is that if your ultrasound unit has a BNR of 5:1 and your average intensity is 1.0, your peak intensity would then be 5.0 watts per centimeter squared. This matters because higher peaks increase the risk of tissue damage via burns. This is the primary reason why we keep the sound head moving during an ultrasound treatment. We want the hotspot dispersed, not left in one area to cause a burn. Frequency refers to how many cycles occur per second and is measured in megahertz. In clinical practice, we most commonly use 1 megahertz and 3 megahertz, although you may also see 2 megahertz or 3.3 megahertz. Frequency determines how deep the ultrasound penetrates. 3 megahertz is used for superficial tissues, about 1 to 2 centimeters deep, while 1 megahertz penetrates deeper, up to about 5 centimeters. Please note that just because 1 megahertz ultrasound penetrates deeper than 3 megahertz ultrasound, it still has to go through the superficial tissues and therefore will be heating those areas as well. When we talk about attenuation, we're describing how ultrasound energy is gradually lost as it travels through tissue. This concept is critical because it determines not only how deep the ultrasound can go, but also where and how much heat is actually produced. There are three main ways this energy is lost: absorption, refraction, and reflection. The most important of these is absorption. Absorption is what actually creates heat. As the ultrasound wave moves through tissue, it causes the molecules within that tissue to vibrate. That vibration creates friction, and that friction converts mechanical energy into thermal energy. This is the primary mechanism behind the heating effects of ultrasound. Refraction occurs when the ultrasound wave bends and is redirected as it passes between tissues with different densities. This means that less energy reaches the intended target tissue, and the energy becomes more dispersed. So when we put this all together, absorption is what creates heat, and refraction can redirect energy away from where we want it. Ultimately, when you're using ultrasound, you're not just applying heat, you're carefully managing how energy is delivered, absorbed, and distributed within the body. Reflection is a bit different. Reflection occurs when the ultrasound wave encounters a boundary between two different types of tissue, especially when there is a large difference in their acoustic properties. Instead of continuing deeper, some of that energy is bounced back. A common example is the interface between soft tissue and bone. The important thing to understand is that reflected energy does not contribute to heating deeper tissues. Instead, it can lead to a buildup of energy closer to the surface or near that interface. Clinically, this is why patients sometimes report a sharp, achy sensation near bone during ultrasound, what we often refer to as periosteal discomfort. In this picture, you can see how the area close to the bone receives double the amount of energy, first as it comes from the ultrasound wand, and second as the energy reflects off the bone back through the same tissue. This is why technique is so important when applying ultrasound. Keeping the sound head moving helps prevent hot spots from reflected energy, and selecting the correct parameters ensures that enough energy reaches the target tissue to produce the desired effect. Different tissues in the body absorb ultrasound differently depending on their structural makeup. Dense, collagen-rich tissues like tendons, ligaments, and joint capsules absorb more energy, which means they heat up more quickly and effectively. In contrast, tissues like blood and fat absorb less energy, so they don't heat as much. This is why ultrasound is particularly useful when our goal is to improve extensibility of connective tissue before stretching. Bone has a very high attenuation coefficient, meaning it absorbs a lot of energy due to reflection as stated above. Due to this, it is at high risk for burns at the periosteal junction. The duty cycle refers to whether ultrasound is delivered continuously or in pulses. Pulsed ultrasound delivers energy intermittently, often at around anywhere between 10 and 50%. It is commonly used at 20%, which means it is on for 20% of the time and off for 80% of the time. When using pulse settings, the tissue that is treated does not heat up, so the patient should not feel any warmth. We will talk shortly about the reasoning behind using this. Continuous ultrasound is used when the goal is tissue heating. Pulsed ultrasound is used when the goal is tissue healing or drug delivery through phonophoresis. Thermal ultrasound increases tissue temperature, which can improve circulation, reduce pain, and prepare collagenous tissues for stretching. The effective radiating area, or ERA, is the portion of the sound head that actually emits ultrasound energy. This helps determine how large of an area you can treat effectively. The effective treatment area when using ultrasound is 2 to 3 times the size of the sound head. It is not a good modality choice if you need to treat a large area. Many ultrasound units have multiple sound heads to choose from. You should choose one that matches the size of the area that you are treating. In the case that you don't have the right size ultrasound wand for the treatment area, it is possible to treat in water or using a gel pad with some ultrasound units. Now we'll focus more specifically on thermal ultrasound and how much heat is necessary to achieve therapeutic effects. This slide shows the minimum amount of heat required to treat based on your treatment intent. This becomes part of your clinical reasoning for your thermal ultrasound settings. For example, if you are heating prior to stretching, you need to increase the temperature of the collagen tissue by at least 3 degrees Celsius. Of particular importance is how much heat will lead to a burn. You need to ensure that your ultrasound settings do not increase temperature by 7 degrees Celsius or more, or you could burn the patient. This table can be intimidating at first, but shows how quickly temperature increases based on intensity, frequency, and circulation. Using the boxes in pink, if we treat using an intensity of 1 watt per centimeter squared and a frequency of 1 megahertz, the tissue will heat up at 0.2 degrees Celsius every minute. If we were trying to increase the temperature 3 degrees to improve collagen extensibility using these settings, it would require a treatment time of 15 minutes. If the math is difficult, think every minute it increases zero point 0.2 degrees. So in 5 minutes, it would increase 1 degree, and in 15 minutes, it would increase to the 3 degrees needed. Now we can see how frequency impacts heating. As you can see, treating with 3 megahertz ultrasound causes the tissue to heat up 3 times as quickly as when using 1 megahertz ultrasound. Remember, 3 megahertz ultrasound focuses its energy closer to the surface, so it is going to heat up faster. If using these settings, if you wanted to increase tissue temperature 3 degrees, it would only take 5 minutes. We can also alter the intensity to change the treatment time. You can see here that if you double the intensity, keeping the frequency the same, the tissue heats up twice as fast. One last consideration is the impact of poor circulation on tissue temperature. As you can see, if someone has poor circulation, their tissue temperature increases rapidly. So you need to know about your patient's health and potential conditions that could lead to poor circulation. Since we know that decreased circulation can easily and quickly burn a patient using thermal ultrasound, what are 3 health conditions or pathologies which could decrease a person's circulation to the area you are treating? In summary, for thermal ultrasound, use continuous mode to create heat, select the frequency based on depth of treatment, and adjust intensity and time to achieve the desired heating effect. Now let's shift to non-thermal ultrasound, which focuses more on cellular and tissue healing mechanisms. One non-thermal effect of ultrasound is stable cavitation. Stable cavitation is a phenomenon in which small bubbles in a liquid oscillate in size due to acoustic pressure from the sound waves. These bubbles create fluid flow and accumulating dissolved gas, which can promote beneficial bioeffects. This fluid flow created by stable cavitation is known as acoustic streaming, microstreaming, or microcurrents. Acoustic streaming is the small, steady movement of fluid caused by ultrasound waves traveling through tissue. Even though ultrasound is a sound wave, it can create tiny currents in the fluid's surrounding cells. These microscopic fluid currents can move ions and nutrients, alter cell membrane permeability, stimulate cellular activity, and help promote tissue healing. The mechanical effects of acoustic streaming and stable cavitation can alter cellular activity and cell membrane permeability, leading to a cascade of physiologic responses involved in tissue repair. One proposed effect is an increase in intracellular calcium within cells. Calcium acts as an important cellular signaling molecule, and increases in intracellular calcium may stimulate the secretion of proteoglycans. Proteoglycans are important components of the extracellular matrix because they help attract and retain water within tissues, contributing to tissue hydration, resilience, and the early stages of connective tissue repair. Non-thermal ultrasound may also influence mast cell activity. Mast cells can undergo degranulation, releasing histamine and chemotactic factors into the surrounding tissue. Histamine increases vascular permeability, allowing immune and healing cells to migrate into the injured region more easily. Chemotactic factors help attract additional inflammatory and reparative cells to the area. While inflammation is often viewed negatively, this controlled inflammatory response is an important part of normal tissue healing, particularly during the early inflammatory phase. Macrophage activity may also be enhanced with non-thermal ultrasound. Macrophages are critical cleanup and signaling cells within the healing process. Ultrasound has been associated with increased phagocytosis, meaning macrophages may become more effective at removing damaged tissue and cellular debris from the injured area. In addition, macrophages can increase production of fibroblast stimulating factors, which help recruit and activate fibroblasts. Fibroblasts are essential for collagen synthesis and extracellular matrix production, making them critical contributors to tendon, ligament, and soft tissue healing. Together, these proposed cellular effects help explain why non-thermal ultrasound has historically been investigated as a modality to support tissue repair and healing at the cellular level, even when significant tissue heating is not occurring. Another proposed effect of non-thermal ultrasound is stimulation of fibroblastic activity, which may contribute to increased collagen production during tissue healing. Fibroblasts are one of the primary repair cells in connective tissue and are responsible for synthesizing collagen and extracellular matrix components. The mechanical effects of ultrasound, particularly acoustic streaming and stable cavitation, are thought to alter cell membrane activity and cellular signaling pathways, which may increase fibroblast metabolism and protein synthesis. As fibroblasts become more active, collagen production may increase, helping support tissue repair in structures such as tendons, ligaments, muscle, and joint capsules. Because collagen provides tensile strength to healing tissue, this process is considered important during the proliferative phase of healing. In bone, non-thermal ultrasound has been associated with stimulation of the piezoelectric effect. Bone is a piezoelectric material, meaning mechanical deformation can generate small electrical potentials within the tissue. Normally, when bone experiences mechanical stress during weight bearing or movement, these electrical signals help regulate bone remodeling by influencing osteoblastic and osteoclastic activity. Ultrasound creates mechanical pressure waves that may mimic some of these mechanical stresses, potentially generating localized electrical changes within bone tissue. These electrical signals are thought to help stimulate cellular activity involved in bone repair and remodeling, which is one reason low-intensity pulsed ultrasound has historically been investigated in fracture healing and delayed union research. Non-thermal pulsed ultrasound is primarily indicated when the goal is to promote tissue healing while minimizing tissue heating. It is most commonly used during acute or subacute stages of injury, such as ligament sprains, muscle strains, tendinopathies, bursitis, and wound healing situations where excessive heat may aggravate symptoms. The proposed benefits are related to non-thermal mechanisms, including acoustic streaming and stable cavitation, which may influence cellular activity, membrane permeability, and tissue repair processes. Clinically, pulsed ultrasound is generally selected when the therapist wants healing-oriented effects rather than increased tissue extensibility or deep heating. Research shows that low-level pulsed ultrasound can improve tendon strength and alignment early in healing without increasing scar formation. Pulsed therapeutic ultrasound is thought to assist tendon healing by enhancing fibroblast activity, collagen synthesis, protein production, and cell membrane permeability, all of which may support the tendon repair process. Pulsed ultrasound may also help modulate inflammation and improve local tissue healing during the acute or reactive stages of tendinopathy, while minimizing the risk of excessive heating that could further irritate the tissue. Although evidence for clinical effectiveness is mixed, pulsed ultrasound is sometimes used as an adjunct to progressive loading programs during tendon rehabilitation. Pulsed ultrasound has also been shown to assist with fracture healing, particularly in non-union cases when applied daily at low intensities. Pulsed ultrasound, particularly low-intensity pulsed ultrasound, has been used to promote fracture healing through non-thermal mechanical effects that may stimulate cellular activity involved in bone repair. The ultrasound waves are thought to enhance osteoblast activity, increase growth factor production, improve angiogenesis, and stimulate callus formation, potentially accelerating the healing process. Low-intensity pulsed ultrasound has historically been used for delayed unions, non-unions, and fractures considered at higher risk for poor healing. Pictured here is an example of a bone stimulator that uses pulsed ultrasound. In this case, it is being used for a slow-healing clavicular fracture. Phonophoresis uses high-frequency, non-thermal ultrasound waves to drive topical medication, such as anti-inflammatories or pain relievers, through the skin into targeted tissues like muscles, tendons, or joint capsules. Non-thermal ultrasound may also increase skin permeability, which is the principle behind phonophoresis. The outermost layer of the skin, the stratum corneum, normally acts as a barrier that limits penetration of many topical medications. The mechanical effects of ultrasound may temporarily disrupt the lipid structure within the stratum corneum and increase movement of substances across cell membranes. Acoustic streaming and stable cavitation are thought to create microscopic alterations in the skin barrier, allowing topical medications to penetrate more effectively into underlying tissues. This increased permeability may enhance delivery of certain anti-inflammatory or analgesic medications applied to the skin during treatment. Under California law, physical therapists may administer topical medications through direct application, iontophoresis, or phonophoresis. These medications must be ordered by a legally authorized practitioner, either through a specific prescription or standing order. When a medication requires a prescription under state or federal law, the physical therapist must follow written protocols that outline the medication's purpose, actions, indications, contraindications, and the proper procedures and techniques for safe administration. This means phonophoresis is permitted in California when performed under an authorized medication order and in accordance with established clinical protocols. For non-thermal ultrasound, we use pulsed mode, lower intensities, and treat for about 10 minutes over an area approximately twice the ERA. Remember, frequency determines depth, and duty cycle determines whether the effect is thermal or non-thermal. For the sake of this class and best practice, perform your treatment in the following order. 1. Position the patient appropriately. 2. Apply gel to wand or patient. 3. Make contact between the wand and the patient. 4. Start moving the sound head. 5. Turn on the machine and keep the wand moving at a steady rate. Thermal ultrasound also has several important contraindications and precautions that clinicians must understand to ensure patient safety. One contraindication is a history of malignancy or applying ultrasound directly over an active cancerous region. Because thermal ultrasound increases blood flow and cellular activity, there is concern that it could potentially stimulate tumor growth or spread malignant cells. For this reason, ultrasound is generally avoided directly over areas of known malignancy. Thermal ultrasound is also contraindicated over a pregnant uterus. Ultrasound waves can create tissue heating, and there are concerns about potential effects on fetal development. While diagnostic ultrasound used in imaging is very different from therapeutic ultrasound should not be applied over the abdomen, low back, or pelvic region during pregnancy. Another contraindication is applying thermal ultrasound directly over central nervous system tissue, such as after a laminectomy where spinal cord tissue may be exposed. Neural tissue has limited ability to dissipate heat, increasing the risk of overheating and tissue damage. Thermal ultrasound should also be used cautiously over certain implanted materials such as bone cement and some plastics like polyethylene. Different materials absorb and transmit ultrasound energy differently, and some implants may heat excessively or unpredictably during treatment. Ultrasound should not be applied directly over a pacemaker. Although therapeutic ultrasound is not electrical stimulation, there are concerns that the mechanical energy and associated heating could potentially interfere with the device or surrounding tissues. Finally, ultrasound is contraindicated over an active thrombus or suspected deep vein thrombosis. Increasing local blood flow and mechanical energy could potentially contribute to clot dislodgement, which could lead to a serious complication such as pulmonary embolism. Additional contraindications and precautions exist for thermal ultrasound because excessive tissue heating in certain regions may increase the risk of tissue injury or other complications. Thermal ultrasound should not be applied over an area of contained infection or abscess. Increasing tissue temperature and local blood flow could potentially facilitate spread of infection into surrounding tissues or the bloodstream. In addition, heat may worsen swelling and inflammatory responses in the involved region. Ultrasound should also never be applied over or near the eyes. Ocular tissues are highly sensitive to mechanical and thermal energy, and the lens and retina are particularly vulnerable to damage from overheating. Even relatively low levels of ultrasound energy may increase the risk of cataract formation or retinal injury. Another contraindication is applying thermal ultrasound over the reproductive organs or gonads. The testes are particularly sensitive to heat, and excessive temperature increases may negatively affect sperm production and reproductive function. Because of these concerns, ultrasound is avoided directly over reproductive tissues. Thermal level ultrasound should also not be used over areas of impaired circulation or impaired sensation. Patients with reduced blood flow may not dissipate heat effectively, increasing the risk of overheating and burns. Likewise, patients with impaired sensation may not be able to accurately report excessive heating or discomfort during treatment. Caution should also be used around cosmetic implants. Some implants may contain materials that absorb ultrasound energy differently than surrounding tissue, potentially leading to unpredictable heating or damage to the implant or surrounding tissues. Finally, thermal ultrasound should generally not be applied over acute fractures. Excessive heating at the fracture site could potentially disrupt the healing environment or aggravate inflammation in the early stages of repair. While low-intensity pulsed ultrasound has historically been investigated for fracture healing through non-thermal mechanisms, this differs significantly from thermal ultrasound used to create deep tissue heating. As always, patient screening, clinical reasoning, and proper parameter selection are essential before applying therapeutic ultrasound. Thermal ultrasound is generally avoided directly over active growth plates, also known as epiphyseal plates, in children and adolescents. Growth plates are regions of developing cartilage located near the ends of long bones where bone growth occurs during skeletal maturation. Because cartilage absorbs ultrasound energy differently than mature bone and soft tissue, there is concern that excessive heating could potentially disrupt normal growth plate physiology. Historically, animal studies suggested that high-intensity ultrasound exposure over growth plates could alter cellular activity and potentially affect normal bone growth. Although the evidence in humans is limited and the exact clinical risk is not fully established, clinicians are taught to use caution because growth plates contain rapidly dividing cells that may be more sensitive to thermal stress. For this reason, thermal level ultrasound is generally considered contraindicated directly over open growth plates, particularly when high intensities or prolonged treatment durations are used. In pediatric and adolescent patients, clinicians should carefully consider skeletal maturity and treatment location before applying therapeutic ultrasound near epiphyseal regions. Finally, always document your parameters clearly: intensity, frequency, duty cycle, time, treatment area, patient position, and response to treatment.